Colleagues, I rise to offer my support and to ask the majority to take up Senate Concurrent Resolution 27, declaring racism a public health crisis in Michigan. First, I'd like to offer a quote by Reverend Nancy MacDonald Ladd. When we say save the rainforest, we don't mean that we cease to honor the mighty cedars or the reaching pines. We mean that one particular piece of the deeply sacred whole is more at risk than the others, and that this risk, this threat, is worthy of our very, very bravest actions. So it is with Black lives in this country. And the message that Black lives matter is important so long as this nation effectively functions as if they do not. Colleagues, it is time for this body to say two simple but undeniable truths. Black lives matter, and racism is a public health crisis. Racism is a long-standing systemic structure in this country that must be dismantled through brutal, honest conversations, policy changes, and practices. There are structural inequalities in nearly all aspects of life, from the economy to housing to our healthcare delivery system. There are clear evidence of racial disparities. We know that the Black community experiences disproportionately higher rates of homelessness, incarceration, and economic hardship that dramatically increases stress and impacts health. We've seen study after study documenting how racial discrimination impedes equal access to stable housing, health care, and other social services that have an impact on health. Even in our capital city, the people's city, our history is plagued with racism. Just one example is the construction of Interstate 496, which many of you drive on every day as you come to session. It began to be built in 1963. By the time the project was finished in 1970, more than 840 homes and businesses in the heart of Lansing's St. Joe Main Street neighborhood, the largest African-American neighborhood, had been demolished. The neighborhood is remembered fondly by people who live there as a neighborhood where the social fabric was tight-knit and where folks didn't have to lock their doors. Because no one in power cared, an entire community was bulldozed and demolished. And what was left was a social construct that left an entire community in ruins. In the midst of our current pandemic, we see disproportionate health outcomes even more clearly. COVID infection rates are 5 times higher in majority-minority zip codes than in white neighborhoods. While African Americans only represent 14% of Michigan's population, they represent a staggering 40% of the deaths of COVID-19. We didn't need COVID-19 to tell us that Black Michiganders have worse health outcomes than white Michiganders, but the evidence is stark. I've heard the talking point that COVID only affects those with pre-existing conditions. Unfortunately for many, being Black in America is a pre-existing condition. African-American Michiganders experience higher rates of asthma, heart disease, fatality rates from prostate cancer and colon cancer. The disparities are wide-ranging and show up everywhere we can see it. Colleagues, we often are too comfortable with our privilege. We have fancy titles. And those of you who look like me, who love someone of the other gender like me, those of us who are born of the gender they identify with like me, have a special kind of privilege. And we must use that privilege to end that privilege. That is how our world heals. And you might say, I have Black friends. The members of my family are Black, that I don't see color. Well, that is little comfort to George Floyd, or Breonna Taylor, or Botham Jean, or Ahmaud Arbery, or Trayvon Martin, or Sandra Bland, or Fred Temple, or Aubrey Pollard. The list is so long, I would need much more than 5 minutes, a lot of the statements to give it. They deserve justice. They deserve action. And in their names and countless others, they deserve our declaration of racism as a public health crisis. We must use our breath to speak out because their breath was stolen from them. Black lives matter, period.